Welcome to Thongyang008 channel.
What is up, guys? Welcome to my channel. It's me here. And today we're gonna be talking about osteoarthritis. So I'm actually really excited for this video because last week we talked about rheumatoid arthritis and we got a lot of great feedback from that video. A lot of people who enjoyed it learned something from it. But this week we're going to be talking about osteoarthritis, which is one of the most common types of arthritis out there. In fact, it makes up about 30% of all arthritis cases. So today we're going to be talking about what is osteoarthritis, what are some of its symptoms, who gets it, and lastly, how we can treat it. Alright, so let's dive right into it. Osteoarthritis is a condition where there is wear and tear on the joints leading to the breakdown of the cartilage of the joint. Now this causes the bones to rub against each other, which causes pain, swelling, and also loss of range of motion in the joints. Now, it typically affects weight-bearing joints, such as the knees and the hips, but it can affect any joint in the body. So with osteoarthritis, we see a lot of pain with activity. Typically, when our patients get up and move around after sitting for a long time, they might notice the stiffness in their joints, especially in the morning. Also, with osteoarthritis, we notice that the pain tends to get worse throughout the day, as those joints are used more and more and more. Who gets osteoarthritis? Well, it can affect anyone at any age, but it's more common in older adults. It's also more common in people who have had a joint injury in the past, or maybe they have a different type of arthritis such as rheumatoid arthritis, which we talked about last week. We also know that people who are overweight or obese are at higher risk for developing osteoarthritis because of the extra load and stress they put on their joints. Lastly, genetics can play a role in osteoarthritis. So if you have a family member who has it, you may be at higher risk as well. Now, the symptoms of osteoarthritis can vary from person to person, but some of the most common ones include pain, tenderness, stiffness, and swelling in the affected joint. People with osteoarthritis may also notice that their range of motion in the joint is decreased, and they may hear or feel a grinding sound when they move the joint. Now, there's many different ways we can treat osteoarthritis. The first line of treatment is always going to be activity modification. So this means modifying or changing the activity that may be causing the problem. For example, if it's a weight-bearing joint such as the knee or the hip, then losing a few pounds can significantly reduce the stress on that joint and slow down the progression of osteoarthritis. We also encourage our patients to perform low-impact activities such as swimming or cycling, because these activities put less stress on the joints than higher-impact activities such as running or jumping. The next treatment option is physical therapy. A physical therapist can teach you exercises that can help strengthen the muscles around the affected joint, which can help take pressure off the joint itself. They can also teach you how to use assistive devices such as a cane or a walker to help reduce the load on the joints. Now, if these two treatment options don't work, then we may recommend our patients to consider joint injections. There are two types of injections we can do: corticosteroids and hyaluronic acid. Corticosteroids are anti-inflammatory medications that we can inject into the joint to help reduce pain and inflammation. Hyaluronic acid is a substance that is naturally occurring in our joints. And it helps lubricate the joint. So we can inject that into the joint as well, to help reduce pain and improve function. Now, if these treatment options fail, then we may recommend our patients to consider joint replacement surgery. This is a procedure in which the damaged joint is removed and replaced with an artificial joint. This is usually considered a last resort, but it can be life-changing for some people with severe osteoarthritis. Alright, so I hope you guys learned something from this video today. If you did, make sure you like and share it with your friends. And if you haven't already, please subscribe. I would love for you guys to be a part of this awesome community. Please leave them below. I love getting to answer as many of those as possible. But as always, remember to take care of yourself, because you're worth it.